It's a taboo topic and an age-old practice across several countries and religious traditions in Africa, the Middle East, and Asia. An estimated 230 million women and girls are subjected to genital mutilation or cutting.
Fred de Sam Lazaro reports from Senegal, where one group has had success in getting thousands of African communities to abandon the practice. A note that the group does not receive any current funding from USAID, so it's unaffected by cuts to that agency. And a warning, this story contains some explicit references.
In the small town of Jalokoto recently, there was a coming out party for several nearby rural communities. A boisterous and until a few years ago, very unlikely gathering called a declaration, attended by elected, traditional and religious leaders. One after the other, these communities came forward to proclaim that they were abandoning female genital mutilation or cutting. It's a removal, partly or wholly, of the clitoris, a practice some scholars trace to beliefs about chastity until marriage or even hygiene, dating back some 2,000 years, one that the UN and governments have long tried to eradicate.
The news rule is you do not cut your daughter.
On a bumpy ride to the declaration, I asked Molly Melching what's bringing about the change here. The key difference, she says, it's not a directive to eradicate, but a decision to abandon cutting.
We need to abandon ourselves. It's not because someone tells us to.
Melching is globally recognized as founder of a group called Tostan, or Breakthrough, best known for helping communities across several African countries abandon FGC. It's not exactly what the Danville, Illinois native set out to do when she moved to Senegal as a student, then Peace Corps volunteer a long time ago.
I would never have dreamed that I would stay here 50 years, although this is a magical country. It's beautiful.
She began in education, working to develop children's reading materials in local languages. In Senegal, books, if available at all, were in French, the former colonial language that few can read or even speak. With a small grant, she began in the village of Samanjai, where she also lived for 3 years.
We saw this great hunger for education among the populations. They wanted to learn to read and write. They wanted to learn more about health and how they could prevent illnesses.
It grew into adult education, first for women, eventually for everyone, and focused on the causes of various health problems.
They wanted to learn what happened to them. We didn't even bring up FGC until much later in the program. And meanwhile, they had learned what are practices that may harm and lead to problems later on in life.
As FGC came up organically, she says, the newly acquired health education helped link the practice to its myriad painful short and long-term consequences, infections, hemorrhage, even sterility and death. Tostan's approach includes teaching about human rights, and in discussing FGC, she says, the message was strictly one of support, not shame.
We understand that you did this not because you wanted to harm your daughters. And no woman wants that her daughter not be able to marry because no one respects her. So they had no choice. And suddenly they realized that together, collectively, today we're going to a declaration of 29 villages. They've come together to collectively decide that this is no longer the expectations.
Although she's not active in the day-to-day running of Tostan any longer, Melching is a celebrity, reconnecting here with many alumni from its education programs. Women like 52-year-old Dusu Sisao, who have carried the torch forward after attending one of the earliest declarations.
In 2003, we did a declaration for many communities around here because of that desire to end violence and practices which are harmful to people, to girls. So now we need to go even farther to other places where people are still practicing.
Her own 3 granddaughters are now free of the pain endured by their elders. Sisao is one of hundreds of so-called social mobilizers for Tostan, traveling to communities to urge abandonment.
How did the men react to all of these changes?
In the beginning, it was hard because the men didn't know what goes on when you practice this female tradition. They just accepted that that was what was done.
We visited Sonkaro Jambang, village chief, now in retirement, who recalls being approached by women in the community. He called together religious leaders. Senegal is a predominantly Muslim country.
They said, "Let us look in the Quran and see where it is written that women must go through this." And they found nowhere where it said that they must be cut.
That interpretation removed a significant hurdle to abandoning FJC in many communities and drew the support of men. Indeed, many social mobilizers and Tostan staff are male, many driven by memories of a loved one's suffering. Melching took time to stop by the family of one late campaigner, Bubu Sal, who years earlier had lost an 8-year-old daughter.
He thought when she got a fever 2 weeks after the FGC operation, he thought that it was malaria. And so he treated her for malaria because he had the pills with him. And when she got worse, he then was told that she had tetanus and it was too late.
It was an emotional reunion with Sal's family. The Tostan manual he used, in the local Mandinka language, was still on the shelf 12 years after his death.
You know, this was the hygiene and health module where Bubu Sal said he learned about the transmission of germs and realized that his daughter died because she was cut with a knife that was not sterilized.
He traveled village to village with his story and guidebook, urging people at Tostan classes to attend a declaration event like the one in Jalakoto. These are a critical step in normalizing social change.
For communities considering abandoning female genital cutting, one last concern is, will they be ostracized for having abandoned a time-honored tradition? The hope from these gatherings is that they can be an instant cure for that stigma. As one person put it to me, everyone now sees that everyone else is doing it.
Melching says that decision to abandon is just one part of a holistic approach to improving life in communities. She took me to Samanjai, the village where it all started decades ago. After a ceremonial welcome, we were shown the latest vision board, a development wish list for the next 10 years, illustrated by hand in a community where not all adults can read. The most pressing priority, adding a doctor to the nurse who now heads the health center they brought to the village a few years ago.
So none of this existed when you moved into this village?
No, this was all empty space here.
It's Spartan, but a solid building block toward better health. The key to Tostan's success, she says, has been to play a supporting, not directing role that's so common in aid work today. Help communities write a grant, for example, or provide health information, and let communities decide for themselves.
How many villages have abandoned now?
Over 9,500
In 8 countries?
in 8 countries.
A small dent in a global problem, Melching says, but a lesson that development works best from the inside out. For the PBS NewsHour, I'm Fred de Sam Lazaro in Jalakoto, Senegal.
And a reminder that Fred's reporting is a partnership with the Undertold Stories Project at the University of St. Thomas in Minnesota.